Hello, everybody. This is Dr. Hamid Elamir, and I am the host of Podcast with Dr. E. At this podcast, I sit with the world's experts in health, education, and community development to talk about current health challenges and ask them to share their experiences, knowledge, and thoughts with all nations across the world, especially the developing countries, so that we can learn from experts across the globe. My guest today is a great public health professional whom I had the privilege to work for when I was doing my master's degree. He is Michael Hodges. Thank you for your time, Michael.
Thank you, Dr. Hamid. It's a pleasure to be here.
Michael Hodges MHS, REHS, and CHES, adjunct professor for Southern New Hampshire University, is the former health officer and director for the West Milford Health Department and former director of health and human services for the city of East Orange, New Jersey. As accreditation coordinator, he also led the process to establish Bloomfield as New Jersey's first nationally accredited health department from the Public Health Accreditation Board, a joint initiative of the CDC and the Robert Wood Johnson Foundation to advance quality and performance of all U.S. public health departments. He's the recipient of the Montclair State University George King Memorial Award for improving the health of the community through leadership and collaboration. He has served as a mentor and internship supervisor for several physicians, including 2 Fulbright Scholars, which I also was one of his interns during my community health project for the Department of Health in Bloomfield, pursuing their MPH degrees. Michael has also served on the board of directors and board of commissioners of the National Commission for Health Education Credentialing. Michael has worked as a food safety and sanitation inspector, infection control consultant, also focused on outbreak investigations and occupational health and safety, or in short, OSHA audits, and health education for Fortune 500 companies. He is currently developing infection control and prevention protocols and providing health education services for City of New York COVID-19 hotel program, as well as administering New Jersey's grant from the CDC for local health department COVID-19 preparedness and response. He plays harmonica too, which I should actually listen to him sometime. It is a pleasure to have you on the show, Michael.
It's a pleasure to be here, Hamid. I appreciate the invite.
Thank you. Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching diseases and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as local neighborhood or as being big as entire country or region of the world. Public health professionals try to prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. And you are a great example of public health professionals, Michael, who has been doing most of the aforementioned tasks. How we address the world's health issues, especially during this pandemic, have massive implications for the future. Dear audience, the goal of my podcast is to highlight the experiences of those confronting public health issues, including this pandemic and its socioeconomic implications, and to better understand what effective leadership is and how it can help control coronavirus and find solutions for health problems. I strongly believe these discussions and insights of world's experts in public health should be shared broadly, and thank you all for joining us today. Michael, I am going to start the very first question. As I always ask my guests, it's kind of like a little more personal question, and I would like to you to also let us know what made you interested in public health and why do you do what you do?
Well, that's a good question, Hamid. I was not always in this field. As a matter of fact, I had several different professional lives, if you will, prior to entering the field of public health. I was involved in benefits administration. I was a mutual fund rep with New York Life. And then eventually, I actually was doing taxes. And I did the taxes for a local health officer in one of my surrounding towns. And it was my interaction with her that spurred me to pursue a professional career in public health, specifically health education. I had always had an interest in health, and I always had an interest in education and teaching. So by studying those, I was able to marry the two together. Now, you mentioned something about public health preventing problems before they happen. And that is one of the main thrusts of my interest in this field. There is an old an axiom that says an ounce of prevention is worth a pound of cure. So if we can put in the work ahead of time to prevent a problem from ever happening, well, then that work was so well worth it, and it has positively impacted lives. So those are some of the reasons why I am passionate about and became interested in public health.
Very interesting story. And what you just mentioned, I actually heard it for the first time, that pound of public health. As they say, like, prevention is better than cure. And that's pretty much in different languages. People use that. So thank you so much for sharing that with us. Tell us about your experience as the director of health departments. Like, you were the director and officer in West Milford and the city of East Orange. What does a health director do actually? And what would be your responsibility if you were still at at that job during this pandemic?
That's a very good question. A health director, and in some municipalities, that person is also the health officer. And that was the case with me in West Milford, is responsible for protecting the health of the public through environmental regulation, through health education, through providing immunizations, providing emergency preparedness, response and planning, and enforcing regulations as well. In West Milford, it's a different, New Jersey is called the Garden State, and there is such variety in this state. West Milford was a more rural area. So much of the public health there revolved around regulation of septic systems and wells. And things of that nature, childhood immunizations. There were some social determinants of health that needed to be addressed there, but not nearly as much as in East Orange, which is an urban municipality, one of the larger cities in New Jersey. So public health in East Orange looks a little bit different than public health in West Milford. There were a lot of communicable disease investigations. Many more retail food establishments and restaurants and stores to inspect and to make sure that the food they were serving was safe, the food they were selling was safe. Hair salons, barbershops, and things of that nature to make sure that they're operating according to the public health laws. New Jersey operates public health laws are based on what's called Chapter 52, which are the public health practice standards. And those standards are based on the 10 essential public health services, which were developed by the Institutes of Medicine many years ago.
Great. So about the 10 essentials of medicine. And it reminds me of my internship when I was doing my internship at Newark Department of Health. And we were focusing basically on those 10 essential of medicine. And this is really helpful, especially for my audience for the show, is people from across the world, and especially here in the US, and as well as where I originally come from, Afghanistan, and some students or some public health professionals. It's really helpful to know what exactly public health officer or public health director of the health department does, and it's not an easy job, as if I put it that way. And thank you so much for all you do, and it's really a job which is rewarding.
It is. It definitely is a rewarding job. You get to see the fruits of your labor over time. Yeah, tangible results.
Absolutely. Could you please tell us what are you currently working on?
Certainly. I'm working on a couple of different things right now. I just started teaching a semester at Southern New Hampshire University, biological concepts of public health. So we're looking at disease.
Yes.
how disease affects the human body in that class. So, of course, many discussions around the SARS-CoV-19 virus. I'm also working as a consultant with New York City Emergency Management. You probably have seen on the news that because of how impacted New York City was and still is to a certain extent with coronavirus, they were taking individuals who were sick, but not so sick that they had to be in the hospital, and isolating them and quarantining them in hotels in Manhattan. So I've been working with the city on that project, helping to develop infection prevention protocols for those hotels to make sure that the healthcare workers that are there treating the patients are able to stay healthy, and to really make sure that there is little to no transmission of COVID while individuals are in those hotels.
Interesting. The New York City, fortunately, the number of confirmed cases is lower, much lower than a couple months ago or a month ago, and so is New Jersey. Unfortunately, while we are speaking today on this show, and there are some cases like across the country in some other states that is increasing, and it's time actually to mention and remind people again about how important it is to abide by the public health guidance and directives, as well as those social distancing and wearing masks and trying to stay at home as much as possible so that we can have better days to come. And of course, this pandemic will be over. And as you see, Michael, here, I have something in the background. I don't know if it's visible enough, but that's what it says, "Let's Yield in Bloomfield." And that was my community project. I mentioned earlier that you were my supervisor, and I have great experience, and I really thank you for all your leadership and the work that we were doing together. And that was part of the job that I did as a community. When I was doing my master's, I had an internship and I had a community health project. So the community health project, as you know, you had other students coming to you, the health department. It was a project that we had to come up with that project and implement it, and then analyze it and submit it back to school.
Yeah,
that was a great experience and a wonderful experience, and that's part of it. And I still see signs in Bloomfield where it, it's for pedestrian safety.
Yeah, Dr. Hamid, you were critical to the success of that program, and your passion for it was beautiful, especially the Vision Zero initiative, and how we were trying to adopt some of those winning principles from that program into what we were doing in Bloomfield. And to your point, during that time, I was a health educator. And although I've gone on to become a health director, I have always valued the role of health education in public health. And in New York City, we're working with the CDC. We're working with Doctors Without Borders with these protocols that we're developing. But we're also developing health education materials to help individuals change their behaviors. And that is crucial to the success of any kind of...
No doubt, yeah.
Yeah.
Absolutely, no doubt. The education, especially, public awareness, it's really important. Like, you know how people are going back to 101 public health basics and common sense. People have to wash their hands and staying away, from touching things around them. It's just that awareness, that education. And when it comes to the developing nations, which most my audience also back in Afghanistan and some other countries, unfortunately we don't have all the the tools and facilities and all the equipment that the developed countries have it. But we have to make sure that people know about the problems and the magnitude of this pandemic, and this very simple basic measures of health literacy, basically.
Yes.
And well, this leads me to the next question, that can you share with us which phases New Jersey now And we're already 2 months in summer. With fall season around the corner, we will be actually. This is a question to me, like personally, and maybe a lot of people have the same question. Will we be able to go to phase 4 in Greater New York area, like all these tri-states before the fall? Like in fall, we are unfortunately thinking, or I mean, we hear that health professionals say that it's going to be a little tougher during the fall and winter time. So are we going to go to phase 4?
It's a good question. And I'll answer both of your questions. New Jersey is currently in phase 2.
Mm-hmm.
That began on June 15th. So some of the moderate risk activities were able to restart. For instance, childcare centers were able to reopen their doors to clients.
Mm-hmm.
Dining establishments, having outdoor dining. So you can have a roof, but you have to have at least 51% of the walls to be open air. So yeah, so that's what New Jersey is in. Now, you asked about New York and ever getting to phase 4.
Mm-hmm.
Dr. Hamid, you know that I love to study human behavior,
Mm-hmm.
and that's part of the reason that I practice health education. Even now, a lot of individuals are traveling interstate, and they are not abiding by the recommended quarantine for 14 days when they cross that border. So because of that, and one of the most popular states to travel to is our neighbor, New York.
Yes.
So because of that, and because of the nature of this virus, where it's possible that up to 40% of those who are infected are asymptomatic, they exhibit no symptoms. They think they are fine, yet they are shedding or spreading the virus as they go. So for that reason, I think we're going to see New York's numbers start to go up again as people travel more, as people let down their guard. And now you asked the question about the fall. Will we be able to enter phase 4 in the fall? My answer is I do not know, but I'm not terribly hopeful. Yeah, I'm not terribly hopeful.
Well, it's really a tough question. To be honest, I've been interviewing public health professionals for a while now on the podcast, and I been following the news and everything about this COVID-19 since the very beginning. And yet I don't know exactly how this is gonna, end. Like, this is a tough question to me myself. And as I hear also most of the time from Dr. Fauci, he says that he's cautiously hopeful, which I think that's a good word to say. And it's hard to tell exactly what's going to be the next step. So we are all hopeful, and let's all work together, to bring this pandemic to an end.
Yes.
Sooner than later.
Indeed.
This is a very interesting and kind of conversation that I have. I have had guests on the show, and when I talk to you, like, it reminds me of all those days of my community project and working together there.
Yeah, we had a good time working together, and it was a pleasure learning from you at the same time as a seasoned pediatrician, and you getting more involved and learning more about the practice of public health. It was really a sharing of information between the two of us. So I benefited as well, and I enjoyed it.
Well, thank you so much for your kind words. It was a learning process for me, and I learned a lot from you, from other colleagues there. And it was it was actually some of the very major parts of my master's degree when I did at the Montclair University. So we are already to the end of this podcast, and let me ask you the last question.
Yeah.
Having worked on social determinants of health and now with COVID-19 response, what advice and suggestions would you have for low and middle income countries such as Afghanistan in terms of coronavirus control? I know the settings are really different. The two countries, it's hard to compare the developing countries. But, as I said, you've worked on social determinants of health. And so what would be your suggestions for those countries?
It's it's not overly simple, but a individual's personal behaviors are their best defense against this disease. So along with those personal behaviors, I would recommend that they come to an understanding of why certain things are beneficial. For instance, as you may know, for the last 15 years, I've been preaching, don't touch your face. That's where our eyes, our nose, our mouth are where we have mucous membranes, and that is where virus and germs enter the body. So that one rule would prevent many people from getting infected. There's also listening to the public health authorities when they issue warnings or even orders. These are designed to protect our health. So you mentioned earlier, washing our hands frequently.
Yeah.
Also trying not to touch those frequently touched surfaces. For instance, even though a place like New York City has picked up the cleaning of the subway and wiping down frequently touched surfaces, even if they weren't doing that, I could still control, to a certain extent, my health by not touching those things at all. So wearing a face mask, a face covering, washing your hands often, not touching your face, and really, Dr. Hamid, trying your best to follow a healthy lifestyle with as little stress as possible, because stress suppresses the immune system.
Absolutely.
Be some of the personal behaviors, some of the things that I would recommend in the circumstances that you indicated.
That's a great advice, and I think changing people's behavior is really difficult. One of the most difficult things that happen. But I think meanwhile, the silver lining of this pandemic is that a lot of people have learned how to be cautious, and in terms of hand washing, environmental health, and personal hygiene and all that. People are very cautious now. By habit, they would be washing their hands. They're not touching. But again, it's really important to remind people, and especially when it comes to those developing countries, as I mentioned earlier, and you put it in a very great way of people's behavior. It looks like very simple things, measures, but it's really important, and it changes the whole picture of this fight against coronavirus.
It really does.
Michael, thank you so much for your time today, and it's been a pleasure to have you on the show, and wish you all the best with with your work, and keep inspiring your students and people around you, and as well as at your work.
Thank you so much, Dr. Hamid. I wish you the same success. Keep up the good work that you're doing. I know that your podcasts are reaching a vast audience, and hopefully individuals are learning from them how to stay healthy.
Well, thank you so much. And dear audience, for more public health professionals and the current health challenges, please stay tuned with Dr. E, and see you all in the next episode.